What's the link between HIV and mental health?
I think in recent years we've got very good at the biomedical management of HIV. We're able to say to people very early on that they can have a very normal life expectancy if they're diagnosed at an early stage of their infection. We're able to monitor them for medical problems and medical conditions. Sometimes, certainly in the UK, we get in there with medicine very, very quickly. And I think in the past maybe we took a little bit longer to get to know people, to understand some of the psychosocial implications of their infection and some of the things that might be important to them before starting with the biomedical side of treatment. And I think some of those things can drop out now a little bit later on in someone's treatment course.
Right.
And I think it remains the case that HIV can be very frightening to people. It can be stigmatizing. It affects something very personal to them. It can affect their sex life and their ideas about fertility and themselves as being vulnerable. And so there are a number of factors that can affect someone's mental health when they're living with HIV infection, and also how they cope with their HIV infection. And then I think, just to add into that, some of the medicines themselves can have an impact on people's mood and on their cognitive function, even if that's just in the short term, and that can be very frightening and alarming to people. So